Hey Kim, how are you? Thanks for taking a few minutes to talk with us.
Sure.
I wanted to ask you, what was your headache situation like when we first met? Can you talk a little bit about that?
Yes, it was all the time. My migraines would go 2 to 7 days sometimes, to the point where I would live in my bed under my covers, couldn't talk to my kids. They had no mom. My husband had no wife. Couldn't exercise anymore. Couldn't think straight to do my job. So they were bad.
On a scale of 1 to 10, how bad were those headaches?
12.
They were 12, so that's pretty bad.
Yeah.
And, how many years had you had symptoms like that for?
I had never had a migraine until my car accident, and that was in 2013. And the first time I had one, I thought something exploded in my brain. I had no idea what was happening. So I struggled with them for about 6 years. I fought having surgery. And then I decided that I had tried everything and wanted to explore this option again, and am very, very glad that I did.
And so you'd taken a lot of different meds and had all sorts of injections, right? And they were just not effective.
Right.
So ultimately we did surgery on all the nerves in the back of the head. And what was the surgical experience like? Can you talk a little bit about that?
It was scary. I was 35 years old, didn't want to have surgery at 35. And going in, was not sure about the whole process, but from Carrie Ann to you, everybody made the whole process very easy. The actual procedure seemed to go fine because I was out for the whole thing. And then going home, I was numb, so there wasn't the fear that I was going to get hit with this pain, and I lived in pain, so I didn't want more pain. So being numb for 3 days was extremely beneficial. And then the healing process was difficult.
In what way? Talk a little bit about that.
Well, because it's scary. You're numb, but you have pain, so you're not quite sure where the pain is coming from. And
was that the same kind of pain you had before surgery, or was more incisional pain?
It wasn't really incisional pain, because that was all numb. Well, I guess after the numbing stuff wore off, it was incisional pain. But it's a weird sensation because you're numb, but you still you're stiff and sore, and it's difficult to move, and the pain is different. The pain is different, more of a pressure, incisional surgical pain versus the migraine, noise, deafening, eye problems, migraine pain. So
Got it. And so now you're 9 months post-surgery. What's going on now?
I feel like I finally have my life back. I'm exercising again. I ran my first half marathon before my car accident, so I'm getting back into shape. I'm able to work again and be a mom to my kids. I'm snowboarding again and mountain bike riding, and I'm not paying for those decisions, having fun, and then ending up with a migraine after. I'm actually getting to enjoy my life again, which has been amazing.
And you look like you lost about 30 pounds. We were talking about that earlier, so congratulations. That's awesome. Well, thanks for taking some time to talk with us. We really appreciate it.
Absolutely.
And one last question. You were taking quite a number of medicines before then.
Yes.
Some narcotics and some neuroleptics. Are you still taking those medicines?
Nothing. I take ibuprofen and Tylenol when I have a headache.
All right. Well, thanks again for taking some time.
You're welcome.